Let me ask you something, and it's a question many haven't considered. When did you last truly take notice of your penis? Not just for its function, but really observe it as a signal, a system, a part of your overall health that subtly reflects what's happening within? Because here's a truth many men don't hear until it's late. Your penis is like the check engine light for your entire body. If it's not performing as it once did, if erections are less strong, if desire feels diminished, if things feel numb, slow, or distant, it's not simply about intimacy. It's often the first alert to a deeper issue. Blood flow, hormone levels, stress, even the risk of a future heart event, can show up here first. And yet, despite this, many men treat their penis like a disposable item. They disregard it, mistreat it, feel embarrassed by it, and then, when issues arise, they panic, search online, and hide. That changes today. In this video, I'm Dr. Anya Sharma, and I'll guide you through 10 common habits that can harm your penis, often without you even realizing it. We'll discuss why these things happen, explore the science behind them, and identify changes you can make right now. I'll also share how to reverse some of the damage, maintain sensitivity and strength as you age, and reveal a surprising truth about intimacy that no medication or device can replace. So, take a deep breath. This isn't about judgment. It's about understanding. Because if you truly care for your body, you won't ignore the parts that are trying to communicate with you. Mistake number 1. Dismissing erectile dysfunction as just a minor inconvenience. Let's be honest. When a man experiences erection difficulties, he often doesn't talk about it. He keeps it hidden. He waits. He hopes it's just stress, age, or a single off night. But what if I told you that those initial signs of erectile dysfunction, slower erections, reduced firmness, difficulty maintaining hardness, aren't just about performance? They're often your body's first gentle indication that something more significant is happening. There's a well-known study that followed men who developed ED. Within 7 years, 14% of them experienced a heart attack. Why? Because your penis relies on healthy blood flow, and the blood vessels in the penis are among the smallest in your body. So, when blood flow begins to be restricted by cholesterol, inflammation, or early cardiovascular issues, the penis is often the first place it manifests, even before you experience chest discomfort or receive a concerning diagnosis. In other words, erectile dysfunction isn't the core issue. It's a symptom. It could stem from low testosterone. It could be poor circulation. It could be stress, diabetes, metabolic syndrome, or sleep apnea. And yes, it could be a combination of these factors. So, what should you do? Don't be alarmed, but don't ignore it either. A weak erection isn't a personal failing. It's a biological signal, and biology provides us with information. Get it checked out. A simple blood panel and testosterone assessment, a blood pressure reading, and a conversation with a doctor can give you a comprehensive overview. Begin with lifestyle adjustments. Walking for 30 minutes daily, reducing sugar intake, limiting alcohol consumption, and getting at least 7 hours of sleep each night can make a world of difference. Your penis is trying to support you, not betray you. It's urging you to investigate further. Mistake number 2. Experimenting with unproven remedies and unsafe shortcuts. Let's be frank. The internet is full of enticing promises. Increase your penis size by 2 inches overnight. Apple cider vinegar will supercharge your performance. Just apply this cream and witness the magic. It's tempting, especially when you're feeling insecure, frustrated, or desperate for a solution. But here's the harsh reality. Most of these DIY solutions cause more harm than good, and some can be downright dangerous. Let me share real-life examples I've seen in the ER, because this isn't just theory, it's what's happening in reality. I've treated men who cut rings from plastic bottles and forced them onto their penis as makeshift constriction devices. One man used a construction nut, yes, a literal metal nut, and passed out while intoxicated with it on. By the time he reached the hospital, his penis was swollen, purple, and nearly beyond saving. Another man attempted jelqing, a supposed stretching technique using hand pressure. However, applying excessive force or doing it too frequently can cause microscopic tears in the penile tissue. This tissue can turn into scar tissue, which then becomes fibrosis. And fibrosis is a direct path to permanent erectile dysfunction. The truth is, there are no safe at-home methods for increasing length, girth, or achieving instant erections. So, here's the rule. If it isn't medically approved or safe for your body, don't use it. No garlic paste, no toothpaste, no plastic bottle rings, no experimental creams, and definitely no electric pumps you found on a questionable website for $9.99. You only have one penis, and there are no replacement parts. Invest in your health responsibly with clinical advice, not clickbait. Mistake number 3, neglecting hygiene and penis skincare. This one is simple, yet surprisingly overlooked. I can't tell you how many men visit my clinic with infections, unpleasant odors, or discomfort simply because they didn't bother to clean properly. And no, simply splashing water on it during a shower doesn't count. Let's break this down. If you're uncircumcised, you must gently pull back the foreskin and clean underneath it every single day. This isn't optional, it's basic hygiene. What happens if you don't? You get a buildup of smegma, a thick, whitish, foul-smelling substance composed of dead skin cells and oils. It's not just unpleasant, it's a perfect breeding ground for bacteria, fungus, and inflammation. If left unchecked, this can lead to balanitis, an infection causing swelling, redness, and sometimes cracks or sores around the head of the penis. It's painful, embarrassing, and completely preventable. Now, let's talk to those of you who are circumcised. You're not exempt either. You still need to clean thoroughly, but gently. Many men overdo it and end up scrubbing with harsh soaps or scented body washes. Don't do that. The skin on your penis is delicate. Harsh detergents can strip natural oils and cause irritation, microscopic tears, and even rashes. Use warm water and mild, unscented soap. Pat it dry. That's all. Also, after sex or masturbation, clean up. Don't just fall asleep or get distracted. Leaving bodily fluids to sit can cause skin breakdown or bacterial imbalance. And a final tip, regularly inspect your penis. Look for sores, unusual bumps, discoloration, or anything that seems off. If you can't pull back your foreskin at all, that's a red flag. It could lead to a serious condition called phimosis or even conceal early signs of cancer. In short, if you wouldn't neglect hygiene for your face, mouth, or hands, don't neglect it for the most sensitive part of your body. Mistake number 4, ignoring pain, bumps, and bleeding. This is one that concerns me the most, not because it's common, but because so many men simply ignore it. Pain during urination, an unusual bump that wasn't there before, a sore that won't heal, a drop of blood in your underwear. Too many men dismiss these signs, hoping they'll resolve on their own. But what if they don't? Let me be direct. These might be your body's early warning signals, and ignoring them could cost you more than just your comfort. It could cost you your health, even your life. Let's start with sores or ulcers. If you notice any persistent wound, especially on the head or shaft of the penis, don't wait weeks to see if it clears up. It could be an early sign of penile cancer, which, though rare, is extremely aggressive when ignored. I've seen cases where men delayed so long that surgical removal was the only option left. Then there's bleeding from the tip during sex or after urination. It could be something minor like a small tear, but it could also be a sign of a bladder infection, kidney stone, or even a tumor in your urinary tract. You don't want to find out the hard way. And what about pain during erections or a strange curve developing in your penis over time? That could be Peyronie's disease, a condition caused by scar tissue that leads to painful, bent erections. Left untreated, it can worsen and make sex difficult or even impossible. Even a small bump could signify a lot, a cyst, a blocked gland, or a sexually transmitted infection like herpes or HPV. The takeaway is simple. If you see or feel something unusual, don't search for it online. Don't wait. Get it checked. You're not less of a man for being cautious. In fact, taking responsibility for your health is one of the most powerful masculine actions you can take. Mistake number 5, unsafe sex and lack of control during intercourse. Let's address something that doesn't receive enough attention: staying safe and in control during sex. Now, I know the idea of safety might not sound very exciting, but let me assure you, there's nothing more freeing and enjoyable than knowing you're protected. No stress about STDs, no anxiety about pregnancy, just you, your partner, and a moment that's fully yours. But this extends beyond condoms and birth control. I want to talk about control, especially physical control. You see, when your penis is fully erect, it's under pressure, literally. And if it moves in the wrong way during vigorous sex, you're at risk of what we call a penile fracture. That's when the tunica albuginea, the thick sheath surrounding your erectile tissue, tears. And when it tears, you'll hear a pop. You'll feel sudden, intense pain. Your erection will disappear instantly. The penis will swell up, bruised and bent, what we call an eggplant deformity. I wish I were exaggerating, but this is a real medical emergency. You'll need surgery, and fast. If you delay, you could be left with permanent erectile dysfunction or a severe curve. That's why I always advise men to maintain a rhythm you can control. Hold on to your partner's hips, stay present, and communicate. Avoid positions that create excessive bending pressure or sharp angles. And never, I repeat, never continue if something suddenly feels wrong. Oh, and one more thing, lubrication. Don't underestimate it. It reduces friction, prevents microscopic tears, and enhances pleasure for both of you. Whether it's natural or store-bought, always ensure there's enough. Especially as partners age, natural lubrication can decrease, and there's nothing shameful about that. It's just biology. Bottom line, confidence in bed doesn't come from taking risks. It comes from knowing you're in control, that you've got nothing to fear, only joy to share. Mistake number 6, overheating your testicles and harming fertility. Here's something many men never consider, and it could be silently sabotaging your testosterone levels and your fertility. Too much heat. Your testicles weren't placed outside your body for aesthetic reasons. They hang low for a purpose, to stay cool. Sperm production requires a temperature slightly lower than your body's core temperature. Even a few degrees too high can disrupt the process. But in today's world, we're doing everything to trap heat down there. Tight synthetic underwear, long hours sitting with laptops on our laps, frequent sauna sessions, and regular hot tub dips. All of it adds up, and over time, it degrades sperm quality and may even impact testosterone production. There's actual research on this. One study showed that prolonged heat exposure, especially from tight underwear or high-temperature environments, can lead to lower sperm counts, reduced motility, and even DNA damage in sperm. That means not just lower fertility, but potentially compromised reproductive health. And let's talk about laptops. If you're working with your laptop on your thighs, especially if it's plugged in, you're essentially cooking your testicles. Add in phone radiation in your front pocket, and you've got a recipe for hormonal havoc. So, what can you do? Switch to loose, breathable cotton underwear. Let things breathe. Keep your laptop off your lap. Use a table or a cushion designed to reflect heat. Limit time in hot tubs or steam rooms. They're relaxing, sure, but use them sparingly. Keep your phone in your back pocket, not pressed up against your groin all day. Remember, protecting your fertility isn't just about future children. It's about maintaining your hormonal vitality, your drive, your energy, your performance, even your mood. Your testicles are working for you 24/7. The least you can do is keep them cool. Mistake number 7, aggressive masturbation habits, also known as the death grip. Let's discuss a habit that's more common than you might think and is silently diminishing your sensitivity: overly aggressive masturbation. Now, listen, there's nothing wrong with self-stimulation. In fact, as we've discussed, it can be a healthy part of male wellness. But the way you do it matters a lot more than most guys realize. There's a term for it: death grip syndrome. It sounds dramatic, but it's very real. It happens when you use excessive pressure and tightness during masturbation, often so tight that it becomes impossible to replicate that same sensation during partnered sex. What does that lead to? Desensitization. Over time, your nerve endings adapt to that intense, unnatural pressure. You may notice it takes longer to climax, or that regular sexual touch, even from a partner, starts feeling numb or insufficient. Erectile issues. When your brain and body become conditioned to a specific kind of solo stimulation, it becomes harder to get aroused or stay hard during partnered intimacy. It's not psychological, it's neurological. You've rewired the pathways. Psychological dependence. Many guys don't even enjoy the act anymore. It becomes more of a mechanical release, a quick, stressed-out ritual done in hiding. And that shameful, rushed energy rewires your relationship with pleasure and intimacy. So, what's the solution? Use lubricant, always. This reduces friction and makes the sensation closer to partnered sex. Ease up. Try using a gentler grip and a slower rhythm. Let pleasure build. Switch things up. Vary your technique. Don't always finish the same way or in the same position. Relearn your body. Masturbate in a relaxed state, not as if you're sneaking in a crime. And above all, remember this: your penis isn't a punching bag. It's not supposed to be treated like a stress toy under pressure. It's a delicate, responsive part of your body, not a machine to be forced into submission. respect it, rewire it, relearn what healthy pleasure feels like. Mistake number 8, ignoring pain, ulcers, or changes in shape. Now, this may be uncomfortable to discuss, but I need you to hear it, really hear it. If you ever notice pain during urination, discomfort while getting or maintaining an erection, sores or ulcers on your penis, or a sudden bend or curve that wasn't there before, do not ignore it. Too many men suffer in silence, hoping the problem will magically disappear. It doesn't. In fact, ignoring these warning signs can lead to permanent damage or, worse, cancer. Let's start with pain. If there's discomfort during sex or urination, it could be something simple like an infection, a UTI, or an STD. But it could also be the start of something more serious. And the sooner you get it checked, the easier it is to treat. Now, let's talk about sores, ulcers, or lesions, especially under the foreskin. If you're uncircumcised, most of the time it's due to poor hygiene or an infection. But in rare, aggressive cases, these can be early signs of penile cancer. And by the time some men seek help, it's too late for a simple fix. I've seen cases where delayed action led to full or partial amputation of the penis. You think that can't happen? It does. And I wouldn't wish that trauma on anyone. And what about shape? If your penis suddenly starts curving, not just a gentle, natural bend, but a painful, noticeable twist, you might be developing Peyronie's disease. This is caused by internal scar tissue that can build up after repeated microtraumas. It's treatable in early stages but becomes much harder if you let it go. So, what should you do? If something hurts, talk to your doctor. If you see anything unusual, photograph it and track it. If you're too embarrassed to go to your regular GP, find a urologist. That's what they're there for. Your penis can give you early warning signs for things like prostate issues, cardiovascular disease, hormonal imbalance, and even cancers, but only if you're brave enough to listen. Ignoring it doesn't make you strong. Taking action does. Mistake number 9, not managing your lifestyle, blood flow, and hormones. Let's take a step back for a moment. When your car isn't running right, you check the oil, the battery, the engine temperature, the basics. Yet, when your penis stops working properly, most men don't think, hey, maybe this is a signal that my whole system needs a tune-up. But that's exactly what it is. Erectile function is vascular, meaning it's all about blood flow. And if blood isn't getting where it needs to go, your penis will be the first to tell you, long before your heart does. There's a reason doctors call erectile dysfunction the canary in the coal mine for cardiovascular disease. In fact, studies show that men with ED are at significantly higher risk of heart attack or stroke within 5 years. It's not just about pleasure, it's about survival. And the most powerful way to protect your blood flow is through lifestyle. Let's talk specifics. Smoking. It destroys blood vessels and decimates your ability to maintain an erection. Period. You might as well inject plaque straight into your arteries. Obesity and a sedentary lifestyle. Extra belly fat means more estrogen, lower testosterone, and more inflammation. That's a triple threat to your sex drive and erectile health. Poor diet. Junk food might taste good, but it's starving your cells. You want blood flow? Eat foods that support nitric oxide production and heart health. Leafy greens, beets, pomegranate, salmon, olive oil, and nuts. Alcohol and drugs. Sure, they might make you feel looser in the moment, but over time they dull nerve sensitivity, lower testosterone, and wreck your vascular system. Chronic stress. If your cortisol is constantly high, your testosterone will be low. That means lower desire, weaker erections, and less energy across the board. You need to protect your mind if you want to protect your manhood. And finally, hormones. Testosterone matters. It's not about being hypermasculine. It's about balance. Low testosterone is linked to depression, low libido, fatigue, and, yes, erectile dysfunction. If you've been feeling off, it's worth getting checked. Your penis doesn't exist in isolation. It's a report card for your overall health. So, take care of your whole body, because that's what truly powers performance.